is to grab the dog around the muzzle. Can everybody see? Pull the lips over their teeth so the air doesn't come out there. And then put your hands around and then put your mouth to their nose and breathe. Again, watch the chest rise when you do that. If they're smaller dogs, you have to worry about breathing too hard. You can cause damage to the lungs by doing that. So, does anybody in here have anything smaller than a Dutch Shepherd? Besides Tom's Beagle? So, a nice breath from you is sufficient enough for them. You shouldn't have to worry about it. So, if there's blood or mucus, vomit in the mouth, try to get a towel, clean that out so they can have a free airway. Again, pull the tongue forward before you clamp the mouth shut so it's as open as it can be. And you breathe into the nose 15 to 20 times every minute. I think that's on your sheet. So, it says you can give 5 quick breaths and then check cardiac function. That's your next thing. So if you see they're not breathing, give them a 5 quick breaths and then check their cardiac function. So again, on their left side, you can sometimes feel it. If you have the stethoscope, you can hear it. Or another way is to check for the pulse. If they have a pulse, then their heart's beating. Sometimes if they don't have enough blood in their system, you just can't feel a pulse. If you don't feel a pulse, doesn't mean their heart's not beating. So use your own judgment. If you don't feel a heartbeat, you don't feel a pulse, they're not breathing, they're unconscious, go ahead and start cardiac massage. The best way to do this is to lay them on their right side. If you're on the ground, then pull them close to you. And again, just like you do in humans, you keep your arms straight. You put your palm of your hand right behind their elbow and press down, and you have to press fairly hard. I know they tell you to do that in humans and sometimes you break ribs, but it'll be the same in dogs because their chest is so wide and deep that you have to really compress to get that heart. So cardiac arrest is nearly always secondary to respiratory arrest. So they'll stop breathing before their heart stops beating. And like I said, if you can't feel the heartbeat or if they're not breathing, continue nose to mouth resuscitation. And if you're doing both nose to mouth and cardiac massage, then give 3 to 4 breaths or give 3 to 4 compressions, give a breath. And keep doing that for at least a minute or 2 and then reassess the situation. One thing that you can check, if their eyes are dilated, so I think y'all know what that means. When the blacks of your eyes are big, it means the oxygenation to the brain has decreased and they're probably not going to survive. At that point in time, it's recommended that you can stop cardiac massage and nose-to-mouth resuscitation, but you can continue based on your own observations. But that is one thing that you can look at in a dog. And I want to note that in deep-chested dogs and larger dogs, it's uncommon to get them back with resuscitation and cardiac massage. Not the fault of whoever's doing it, it's just hard to do it in them. And you can read about that. I wrote a little bit about it in your handout. But